How's it going, you guys? So in this video, I'm going to be talking about the differences between functional medicine and complementary medicine, okay? So, first of all, what is functional medicine? So functional medicine was a form of medicine that, personally, it's my opinion that it was popularized by Dr. Mark Hyman, who I'm a huge fan of. And, basically, functional medicine is combining the best of the best worlds of all the different forms of medicine: alternative medicine, nutritional therapies, orthomolecular medicine, which is using vitamin therapies, using amino acids and stuff, and also using modern allopathic medicine, medical drugs and surgeries and diagnostic tests and these types of things. It's combining all of the medical philosophies that actually work and trying to address the root cause. That is the biggest part of functional medicine, is that they aim to find the root cause and use modern medicine as well as nutrition and all these other things, using all the different therapies available to solve the root cause and support you every step of the way. What is complementary medicine? So complementary medicine was a philosophy that was heavily popularized and I believe founded by Dr. Andrew Weil, who was a huge figure in the natural medicine community, huge figure in government guidelines and influencing our society towards holistic healing and things like that, like healing the whole person and addressing the whole lifestyle, rather than just like, if you have pain, take a pain medication or whatever. Throughout the 1900s, from like, I don't know, the 1960s, 1970s, or something like that, maybe the 1980s, all the way until recently, even though Andrew Weil is like in his 90s now and he's kind of retired. Complementary medicine is combining the best of alternative medicine, meaning Chinese medicine, herbalism. Those are the main alternative medicine things Andrew Weil talks about, is using Oriental medicine, like Chinese medicine and Ayurveda, using things like meditation and even using things like psychedelics, I think he had talked about that. As well as vitamins and minerals and things, and combining that with medical drugs, because he is a medical doctor, just like Mark Hyman. So things like if you have cancer, he recommends getting radiation or chemotherapy, but at the same time using reishi mushroom to support the immune system. Probably mostly because of its its chemoprotective effect shown in studies, as well as its traditional use to boost the immune system. Same thing like chaga mushroom, things like ginseng and astragalus and so using the allopathic pharmaceutical medicine that we have, even maybe things like statin drugs. I don't know what his opinion is on that, as well as nutrition and and hawthorn berry, for example, which is like an herb that's been used to treat heart disease. So combining the best of alternative medicine with pharmaceutical medicine, that is what Andrew Weil is about. It's basically what you would call integrative medicine. So integrative medicine, I believe, is his coined term. Now, functional medicine and integrative complementary medicine is very, very similar, okay? They both use kind of like medical drugs to an extent, combined with natural therapies. But I think the main difference is that functional medicine is a lot more based on using nutrition and lifestyle, not only to prevent disease, but also to solve disease. Functional medicine is much more aimed at doing the best you possibly can to avoid using pharmaceutical drugs. Whereas integrative medicine or complementary medicine by Andrew Weil is focused on like specifically combining the two to overcome the illness. So they're both very, very similar and used in pretty much like, you could be a practitioner of both probably, but I think integrative medicine is much more focused on pharmaceutical drugs, at least more than, pharmaceutical therapies more than functional medicine is. But I think functional medicine also depends on the practitioner. So, I'm a fan of both these guys. I don't agree with everything they say. I definitely don't agree with a lot of Andrew Weil's nutrition advice. And Mark Hyman has a lot of weird beliefs about like heavy metal toxicity and things I don't think are as relevant or as important. Both really good things to look into, especially if you're just a fan of health and nutrition information in general, and you like researching this stuff like I do. Andrew Weil has a lot of good books on, like he was one of the first people to kind of talk about like how you might not even need, drugs and therapies for things like cancer, how the body has like an innate healing response. So Andrew Weil actually published a book called Spontaneous Remission or Spontaneous Healing, and I own that book, where he goes into detail about stories of like actual case studies of people who put cancer into remission without pharmaceutical therapies, and also about people who have healed themselves from cancer with pharmaceutical therapies combined with, alternative therapies too, basically using his integrative medicine approach. So that's a really awesome thing. He was one of the first people who was really making others know, like, hey, there's more to healing than just like, treating the physical body with like drugs and irradiation and stuff. He was talking about spiritual practices and how people had to change their entire way that they live their life and that they view life. Give yourself purpose and meaning to help enhance your immune system and stuff like that. What people will call it pseudoscience, even though I think pseudoscience is a dumb term. Talked a lot about using meditation for healing, and how stress affects the immune system, and stress can cause illness. He talks about how loving relationships and community is very important for living life and being a part of like a culture. He's real big on like Asian culture. He has a graduate degree in botanicals, like herbalism, as well as biology and other things. He's a huge fan of like matcha green tea and like Chinese herbs and things. So there's a lot of really good information from Andrew Weil. Mark Hyman's more about using vitamins and amino acids and stuff like that, as well as nutrition, whereas integrative medicine is more on the spiritual kind of woo-woo side. But I do think all of those things are great, lots of good ideas on both sides, as long as you don't just like full on blindly believe in one or the other. So with that being said, post your questions and comments down below. Let me know what you guys think. What do you think the differences are between the two? And I'll talk to y'all next time.